Now we'll discuss about fingertip oximeter. Fingertip oximeter is a pulse oximeter, non-invasive and painless test that measures your oxygen saturation level. The pulse oximeter is a small clip-like device that attached to a body part, and the purpose of pulse oximeter is to check how well your heart is pumping oxygen through your body. And it can be used to monitor the health of the individuals with any type of condition that affect the blood oxygen levels. The conditions include asthma, pneumonia, lung cancer, anemia, heart attack, congenital heart defects. And the main working is during the pulse oximeter reading, a small clamp-like device is placed in a finger. So it does this measuring changes of light absorption in oxygenated or deoxygenated blood. So this is a painless process. This will able to tell your oxygen saturation levels along with your heart rate. And the procedure steps is most commonly a clip-like device will be placed in a finger. You may feel a small amount of pressure, no pain, and you will keep the probe for as long as needed to monitor your pulse and oxygen saturation. So during surgery, a probe will be attached beforehand and removed once you awake and no longer under supervision. So once the test is over, the clip or probe will be removed. So you can see in the diagram, this is the pulse oximetry. It's a fairly accurate test and provides results within 2% difference either way of what it truly is. The factors such as movement, temperature or nail polish can impact the accuracy, and this is the oxygen saturation level needed to keep your cells, your body healthy, and level of 92% indicates potential hypoxemia or deficiency in oxygen reaches the tissues in the blood. Next is the ESR, erythrocyte sedimentation rate. So it is a type of blood test that measures how quickly that erythrocytes means red blood cells, settle at the bottom of the test tube that contains a blood sample. So a faster than normal rate may indicate inflammation in the body. So ESR test can help to determine if you have a condition that causes inflammation, and ESR may also be used to monitor an existing condition. So why do I need ESR means main symptoms is headache, fever, weight loss, joint stiffness, neck or shoulder pain, loss of appetite, anemia. So what do the results mean is, so it may be related to the inflammatory condition like infection, rheumatic fever, vascular disease, heart disease, kidney disease and certain cancer diseases. So sometimes the ESR can be slower than normal. So this may cause polycythemia, sickle cell anemia, leukocytes and abnormal increase in the white blood cells. How does the ESR test work is, so they'll take blood sample and after 1 hour later, so males for 3 to 6 mm and females is 8 to 10 mm, and here they'll split their white blood, red blood cells, plasma, and then it is used for the distance in mm. The red blood cells have fallen in 1 hour. So the blood test that can reveal the inflammation that may be caused by infection and some autoimmune diseases. Next is the GSR, that is galvanic skin response. So this is whenever you experience an emotional reaction to the stimulus, that is your body, it responds producing sweat and increase your skin electrical conductivity. So this is measure of skin conductivity and perhaps most well known as an element of polygraph. GSR is the major component of our biometric toolkit, and we use GSR to understand what the elements of fundraising campaigns. So how does this work is a GSR sensor allows to measure sweat gland activity, and it take advantage of electrical properties of the skin. The most to measure the signal is not resistance but conductance. The conductance make the signal interpretation easier, and GSR sensor applies a constant voltage, usually 0.5 volts. The purpose of this circuit is to measure the skin conductance and its variation by applying Ohm's law. So with this step, any fluctuation in the current flow is due to the change in the electrical properties of the skin. So therefore, the sweat gland activity. So this is the diagram. So this is the GSR, and the voltage supplier resistor and skin resistor, and the intensity is measured. Thank you.